Why does my knee hurt when I walk? If your knee hurts when you walk and you'd like to figure out how to get rid of your knee pain fast, then this video is for you. Hi, I'm Dr. Dave Candy, and in this video, I'm going to show you a very simple way to get rid of or substantially reduce your knee pain today, plus some long-term strategies to keep it from hurting again in the future. Now, first of all, what causes knee pain when you walk? There are all kinds of different structures that can cause knee pain when you walk. Either pain on the inside of your knee or the outside of your knee or the front of your knee or the back of your knee. And I've made different videos covering all of those different topics, which I can link to. But the more important thing is, why did those structures start to hurt in the first place? And the good news is that there's relatively few reasons why all of those structures start to hurt. So whether it's a muscle problem or a tendon problem or a joint problem with your actual knee joints or with the joint between your kneecap and your knee, there are largely two different walking issues that cause all of those different structures to hurt in the first place. And so if you fix the walking problem, it fixes a lot of different types of knee pain, regardless of the specific structure that's involved. And so those two walking problems have to do with problems in the front and back plane, and then in the side to side and rotational plane. So the problem with the front to back plane usually has to do with either your knee straightening too much or your knee not straightening enough. And that second one is by far the more common problem, where when you walk, you don't get full knee extension, your knee doesn't get fully locked out. And what that means is that you have to use your thigh muscles throughout your walking phase to keep your knee from collapsing. Your knee might even feel a little bit unstable if that's happening, like it could buckle or give out on you, because you're always having to use your thigh muscles, your quad muscles to hold you up. And the longer you walk, the more tired those muscles get, which makes the knee feel less stable and more unsteady. So if you're getting that feeling of giving way, like your knee might give out or buckle, or you're feeling stiffness in the back of the knee, those probably have to do with that front to back plane movement problem. Now, by far the most common problems that people have with their knee when they're walking are pain on the inside of the knee and pain on the outside of the knee. And both of those type of problems are usually caused by this knee going inwards type of motion. That can happen because of weakness in your foot muscles, stiffness in your ankle joint or in your calf muscles, or weakness in your hip, and most commonly a combination of several of those. So how do you fix those walking problems so that you can get rid of your knee pain or substantially reduce your knee pain fast? Well, the quickest, easiest solution is just to take smaller steps. And the reason for that is when you take a large step, you need a lot of mobility out of your ankle joint and your calf. But when you take smaller steps, you don't need quite as much mobility. Now with the side to side problem, if you can't stretch your calf as much, in order to get your body weight over top of your foot, a common compensation is to turn your foot out or pronate and flatten your foot, and the knee goes inwards, which again can cause problems on the inner knee or the outer knee. But when you take shorter steps, because you don't require as much flexibility out of the ankle and the calf, that allows you to not pronate and make your knee go inwards. So by taking shorter steps, most people have an almost instantaneous relief in their knee pain, and sometimes it goes away completely. But on the other hand, you don't want to become the person who just takes really small steps and shuffles around like that. So while that's a good short-term fix, it's not necessarily a long-term solution. So in order to improve your knee pain over the long term, you need to fix the mobility problem in the ankle as well as the strength problems in the foot and in the hip. And here are two simple exercises to help you improve the mobility in your ankle as well as the strength in your hip and in your foot. So for the ankle and the calf mobility problem, just doing a calf stretch is a great way to improve mobility in your ankle and your calf. But you want to make sure you're doing your calf stretches properly. The way that many people do their calf stretches is they allow their foot to turn outwards like that and stretch in that way. But that's analogous to allowing your foot to overpronate when you're walking and having your knee go inwards. So if you're stretching this way, if this is the way you practice, it's the way you're going to do it in real life too. So in order to stretch your calf without allowing that compensation to happen, you want to make sure that your knee's aligned with your toes. It does help to put your weight a little more on the outer side of the foot. Keep your heel flat on the ground, so you don't want it coming up like that. And then just stretch in until you feel a very gentle stretch in the back of your calf. This shouldn't be an extreme stretch. Just go till you feel a very slight stretch and then hold it for a long period of time. Ideally a minute or 2 minutes if you can, or if you have to break it up, just try to get a minute or 2 minutes total stretch time. So that's the first exercise, and that's for mobility in your ankle and flexibility in your calf. Now to work on the strength issue, you need to be able to stand on one leg while taking a step with the other without your foot overpronating or without your hip allowing your knee to go inwards. And so to practice that, just practice standing on one leg. You want to try to keep your knee over top of your toe and not let it twist in that way as you put weight on one foot. So get your hip, knee, toe in alignment, and then practice taking the weight off of this foot, trying to hold that alignment. You don't want your pelvis to drop, so sometimes it helps doing this in a mirror so you can make sure you're not doing that. You also don't want your knee to collapse inward or your foot to flatten. So it helps to kind of make an arch with your foot, kind of curl your toes and dome the arch of your foot a little bit. Put the weight on the outer side of your foot and curl the toes inside your shoe, and then squeeze your bottom muscles on the side you're standing on so that you keep your knee from twisting inwards and you keep your pelvis level. If you're just starting out with this, it does help to have something to hold on to, not only for efficacy, but also for safety. So it's better to hold on and be able to maintain your knee in the correct alignment than it is to wobble all over the place just to maintain your balance without holding on. So use a wall, use a piece of furniture, use a cane, use a chair, whatever you have by you. So those are the two exercises to help you walk better over the long term. And just to review all the tips, remember in the short term, you want to take shorter steps. That decreases the need for calf flexibility and ankle flexibility. It also can help you compensate if you have some weakness in your hip or foot muscles. And then for the long-term strategies, you want to stretch out your calf muscles and strengthen your hip and foot muscles by standing on one foot. Now, there's an easy way that you can combine all of those into one simple exercise, and you can find that in this video over here, or for more tips on how to walk more comfortably, check out this video over here. But before you go, if you did find this video helpful, give it a like and subscribe to our channel so you can get notified of our future videos. Thanks for watching, and I'll see you in the next video.